Hi, today we have systemic lupus erythematosus, SLE. So, first of all, let's begin with the definition. So, it's a chronic autoimmune system inflammatory disease of connective tissues that develops in subjects predominantly in young women with hereditary immune defects and characterized by synthesis of autoantibodies as protein manifestation and follows a relationship and remitting course. Etiology. The etiology of SLE remains unknown, but more common in female. A genetic predisposition, sex hormones, and environmental trigger result in the disordered immune response that typify the disease. Pathogenesis. Immune complexes are central players in the tissue injury in SLE. They are formed in large amounts as antinuclear antibodies bind to the abundant nuclear material in blood and tissues. Classification. Class 1 Minimal mesangial lupus nephritis. Class 2 Mesangial proliferative lupus nephritis. Class 3 Focal lupus nephritis A. Class 4 Diffuse lupus nephritis B. Class 5 membranous lupus nephritis, and Class 6 advanced sclerosis lupus nephritis. Clinical manifestation: patient will have fatigue, arthralgia, myalgia, and more serious constitutional features of SLE is persistent fever and weight loss. Also, you will see mucosal ulcers, inflammatory cirrhosis of the pleura. We will also see pericardium and peritoneum inflammation there also. We can see anemia of chronic inflammation and glomerulopathy. Diagnosis. So, methods of diagnosis. First of all, urine diptych. Increased protein and red cell casts in the urine. In the blood test, we will see anemia, thrombocytopenia, leukopenia, lymphopenia, raised ESR, and CRP. In ANA testing, we will see concentration of antibodies does not reflect the severity of the disease. Another method, antibodies to double-stranded DNA, dsDNA, is highly specific for the SLE. Diagnostic criteria: we have more than 4. We can see malar rash, oral ulceration, discoid rash, which is a round or oval rash seen on areas of skin exposed to the sunlight. We will see arthritis, photosensitivity, serositis. We will see neurological disorders like seizures, psychosis, renal disorders like proteinuria and red cell casts in urine, as we talked about before. We will see hematological disorders like leukopenia, lymphopenia, hemolytic anemia, also thrombocytopenia. Immunological disorders like antibodies to double-stranded DNA and anti-SM antibodies. Also ANA positive. Complications will be skin scarring, joint deformities, kidney failure, stroke, heart attack, pregnancy complications, and hip disruptions, also known as vascular necrosis, and last one, cataracts. The treatment: first of all, lifestyle changes, healthy diet, quiet smoking, and some protection and exercise are necessary for any patients, especially here. Another method of treatment: we can give NSAIDs, non-steroidal anti-inflammatory drugs like naproxen 500 mg twice daily, maximum 1500 mg daily. We can give glucocorticoids like prednisone 5 to 40 mg daily. Also, hydroxychloroquine dose of 400 mg daily. That was all. Thank you.